With just a few numbers, some patients can hear a few welcoming words.
Para español, presione uno.
A Spanish language option is nothing new. But what the folks at UCHealth are doing seems to be.
We're very proud to be on the forefront of this new technology and to make that telephone access barrier that is caused by language be a thing of the past.
Scott Succo is with the hospital's language services. Recently, the department revived its interpreter services with new technology that almost instantly connects a caller with their preferred language.
Even before you start talking to the operator, they will be able to use caller ID in many cases and pull up your medical record to see what your preferred language is. And if it's a language other than English, they can almost instantly bring in an interpreter through a simple click of the button into that language so that you're speaking to an interpreter almost as quickly as you're speaking to the operator.
Before this system, operators were tasked with trying to identify the language, putting the confused patient on hold while trying to track down the right interpreter. The new tech cuts a lot of that out. Because of that, UCHealth says they've seen a roughly 60% increase in non-English calls compared to last year. In their first month, they took 6,000 calls in 44 different languages.
Much of what we develop is sort of English-centric, and this is using technology to bring those folks into what we have to offer.
Succo estimates 1 out of every 8 patients do not have English as their preferred language. It's numbers like that, he says, prove why words are important.
It's very innovative, it's very valuable, and really makes healthcare work for them.
While this is a game changer for existing patients, UCHealth officials say it also cuts down on the time to connect new patients with an interpreter once they have the preferred language established. They say Spanish is the top language that is requested.
Makes so much, one of those things like, why haven't people done this so much longer ago? Like, this makes so much sense.
Yes, it's so convenient, so easy, and honestly, it helps with privacy because we see a lot of non-English speakers rely on maybe their neighbors or their children to help interpret medical records, right? So this makes things a little bit easier for them.
I love the inclusivity. Good on them. And the first in the country, that is awesome.
Mm-hmm.
Yeah. Jaleesa, thank you.